the cloud. Okay. All right. Okay. Well, it is about 6 o'clock, and I'm going to give a few more minutes and see if we have some folks still trying to log on. So we won't wait too much longer because I do want to honor everyone's time, but we'll wait just another minute or two. Okay, well, that's a couple of minutes after 6. I think we're going to go ahead and get started. And if anyone wants to join in, they can go ahead and do that. Of course, this is a recorded presentation. So if any part is missed, it's something that you can always go back and tune into and catch it again. So welcome this evening. I want to thank you for joining us tonight for What Do I Need to Know About Mental Health? Such an important topic right now. My name is Angela Shack. I have worked in the district for more than 20 years in various capacities as a campus counselor and at-risk social worker, and currently work with the Behavioral Health Services Department and work with Amy Grosso, who is Dr. Grosso, who is our director, who was hoping to join me this evening, but has another meeting that she had to attend. So I'll be sharing the information, partially much of it that she's put together for us this evening, and some of the slides that I also included, because we are going to talk about sort of two areas of how to get support and resources for mental health needs. And one of those, of course, is campus related and here in the district, but the other is out in the community. So we're actually going to start with that. And then we'll proceed to the end, and we do have time at the end for questions. So as we go along, if you do have a question that comes up, please go ahead and put it in the Q&A. And when we get to the end of the slides, we'll make sure that we address any questions that come up during the presentation. So welcome again, and thank you for attending. So the first thing, again, as I mentioned, we're going to talk about community mental health services, and then we'll talk about ways that you can access information in the district. So the first direction we're going to go is what is the difference between the providers that are out in the community? And most often, if there's a mental health need, the providers that you might consider reaching out to would be one of these types of providers: a psychiatrist, a psychologist, a social worker, or a counselor, clinician, or therapist. And we're going to take these one at a time and talk about what their specialties are, and help give people direction on who might be the best, or which one of these might be the best resource to go to based on what your needs are, or your family's needs. So let's go the next one here. The first one, psychiatrist. So a psychiatrist is a medical doctor. They usually have an MD or a DO, and they will be specializing in mental health. As you can see there, one of their primary focuses is to assess what the situation is, make a diagnosis, and then most likely prescribe a medication that they feel like is going to help relieve the symptoms of whatever situation might be going on, whether it's depression or anxiety or some other disorders that may be diagnosed. The important thing to know about psychiatrists is there's not very many that actually do the psychotherapy portion. Most of them are just going to, not just going to, but they're going to monitor medication and make sure that it's effective and if there's any side effects and help make the recommendations for that. I have run across a few psychiatrists in the area that do also work with their clients and patients in a therapeutic setting where they do what we call the talk therapy, where you sit down and talk about the issues at length. But most of the time when you go to see a psychiatrist, it's a short visit. They're going to ask you questions about how you're feeling and how the medication's working and make some adjustments. And that's usually the extent of those visits. Many of them do, or some of them do, specialize in pediatric psychiatry or adolescent psychiatry. So if you're working with a child that you're concerned about, I think it would be important to consider someone with that specialty. As we know, younger children do have some special situations that make it a little bit trickier to prescribe medications. And so someone who specializes with children and adolescents would be a good resource. If you have a child that you're concerned about. There's also psychiatric nurses who can also assess the medication needs that oftentimes work in those offices. So when you make an appointment, you might see the psychiatrist first, and then, for follow-up appointments could be visiting with a psychiatric nurse to continue the treatment. So that's a little bit about the psychiatrist. A psychologist is a PhD or a PsyD, and of course they've gone on to get a doctorate so that they have some specialized training, and they too can also diagnose and look for psychological assessments to determine what is causing some of the symptoms that people may be experiencing. They oftentimes are going to be doing their psychotherapy and working with you individually or as a family perhaps. But the other thing they specialize in is research. So they tend to come from still that medical model and a lot of research-based approaches to what's going on in the mental health area. Some will provide some specialized assessments for things such as autism or attention deficit hyperactivity disorder. And those are people that you might go to if you have a child that you're concerned could have some symptoms of either one of those kind of conditions that you would like to have them do an assessment. So oftentimes they're the type of folks that will run some additional tests and be able to help you determine if that might be part of what's causing some of the concerns. Of course, they're licensed by the state and have ethics board and various things that they do follow along with other practitioners, which we'll talk a little bit about too. One of the questions that often comes up with psychologists is, can they also prescribe medication if they do find that there's a condition that might, where there might be a benefit from medication as well? Most often they cannot prescribe medication. There's only a few states that do allow psychologists to prescribe medications. It's Iowa, Idaho, New Mexico, Louisiana. There may be one other, but not Texas, unfortunately. I think that was originally because they needed more psychiatrists in some of those areas. And so they permitted psychologists to also prescribe to help see more patients and take care of some of the needs in that area. So let's go on to a clinical social worker. And this one I could talk at great length about because that's in fact what I am. So The clinical social worker is a little bit different than traditional counselors, and we'll talk about that in a moment. But as a social worker, they do require that you have a master's degree in social work and from an accredited university. And of course, during that training, clinical social workers do have special treatment or training for treatment for mental health and develop theories as far as how to work with clients to improve their mental health. And so they also do assessments and make a diagnosis, but they also will look at other issues beyond just the individual that may be coming in for the session. One of the things that is, I think, especially important about social workers is that they training takes a systematic approach, which means they are looking not just at the person, but also extending beyond that person. Are they needing something within their family? Are there some conflicts there? Or is there an issue that we need to address in the family? Is there something about the community they live in? Do they not have access to adequate housing or food? Or is it a situation where they may need some employment, career training, and just really looking into the community and helping those folks connect with those resources so that they're not only addressing the mental health immediate need if the person's coming in with depression or anxiety or some other concerns, but they're going to also look at the family needs and beyond to see if they can assist in those areas as well. And to become a clinical social worker, in order to do a practice where you're seeing patients individually, or sometimes they work with families as well, most of the time, or a lot of the time actually, they have a licensed, I'm an LCSW, which is a licensed clinical social worker. There's another designation there, you'll see the LICSW, licensed independent social worker. And that's really just the differences in how states, it's the same thing that states just have a different way of listing that based on their board, accreditation board. So here in Texas, it's LCSW. You may see sometimes LMSW, and that does mean that the person has a master's and has gotten that additional training. But the C, the clinical part of that, means that the individual has been in practice for, at least 2 years or more, and has gone through additional supervision and has taken an additional board exam, and that has gotten that certification. So it gives that person a little more specialty to do private practice and work with clients that way. It's also different than social work that sometimes people think of when they're looking at folks who are involved in more of the administrative, social justice, trying to help communities build, support for people. So that's a little different track. The clinical social worker training is more directed towards working with mental health needs. So, and let's look. Now let's look at the group of counselors, clinicians, and therapists. And there's a wide variety of folks who fall into this category. They also are at master's level, and they have gotten that additional training so that they can evaluate a person's mental health needs and provide those therapeutic techniques as well. There's 2 licenses listed there, but there's several more that we could list. The ones that we hear most often are LPCs, which is a licensed professional counselor. Again, they have gotten a master's degree in counseling and have gotten taken additional steps to get a license in order to practice, so they can do private practice as well. And the LMFTs, which is the licensed marriage and family therapist. So if you're having some issues in your relationships, those are people who have special training working with couples and oftentimes work with families as well. So they can help if there's some conflicts there that need to be addressed. Some of the ones that we didn't list here is the um, licensed chemical dependency counselors. They have some licensing that's involved. Their training is not quite as stringent. They don't require a master's level to get a license, but they do have that specialty and can work if there's some substance abuse issues that may need to be addressed. And then the other thing that's not listed that you'll hear in the school system is LSSPs, and those are the licensed school psychologists. And they will typically on a campus, they're doing a lot of the diagnostic testing. So if there's a child who has a learning disability that's suspected, or even if they're looking at some attentional issues along with those types of assessments, they can do some of those testing instruments as well. So they do a lot of the testing, but they do also work with students to develop some social skills and behavioral strategies as well. So you might run across the LSSPs on campuses here in our district. So that's just a little bit about the counselors and therapists. And of course, they can work in many different settings, just like social workers. They can work in schools, they can work in private practice, they can work in hospital settings and agency settings. So you'll see those various different licensures show up in a lot of different places. All right, so now it's really trying to determine, okay, what is the right direction to go when you do have a situation that you're concerned about, whether it's yourself or your child or someone in your family. How do you decide which one is going to best serve your needs? Let's look at that. Oops. So again, we're somehow that done. So the three different community resources that you might go to. There it says individual therapy, and somehow the Y wanted to drop down there. We'll talk about that. We'll talk about partial hospitalization programs, and then we'll talk about inpatient hospitalization programs when you're out in the community and how those will serve you or the people in your family. So first of all, starting with individual therapy, again, with some of those licensures that we were just talking about, individual therapy is often called talk therapy. And this is often when there's one individual that will go in to see a therapist and want to talk about some unresolved issues, some things they're feeling, maybe some traumas in their past, and some other health issues, mental health related issues. And they can help with a variety of strategies. Let me move the screen over so I can actually, there we go, see a little bit more there. So they use different approaches and different ways of helping people determine what's going to be the best way to get some assistance with those mental health needs. Again, as I mentioned, they may work with couples, they may work with families if it's a situation that's a conflict within the entire family. And oftentimes when you go to see an individual therapist or psychotherapist, as they're called, they're going to meet with you for about 50 minutes a session, and they may see you for a couple of visits, or it could go on for whatever length of time you both determine is needed to address the issues that you have concerns about. They do sometimes offer group therapies, but most of the time it's, and if they do that, it's usually a specific time limited type of thing where they're doing something on stress management or maybe a group on depression or anxiety. But most often the individual therapist is going to be working with individual patients and families. So those might be some of the LPCs, the licensed professional counselors that we were talking about, the LCSWs, the licensed certified social workers that we referenced earlier. Also the psychologist, as I mentioned, oftentimes do individual psychotherapy. And those other ones, the other folks as well, the marriage and family therapist and chemical dependency therapist. So this is where you would go into an individual office and meet with them. Now, partial hospitalization is, I think, a unique program in that it is more intensive than, as we're going along, you'll see that it's more intensive. So we'll talk about that, but let's first talk about some of the things that you may hear when people are talking about partial hospital programs. You might hear people call it a PHP. That's the partial hospital program. And that is a full day program. And that's going to be more intensive than the intensive outpatient program, even though the title might imply that the intensive outpatient program is just the word intensive makes it sound like it is for more acute situations. And you'll often hear that abbreviated as an IOP program. So what that involves in partial hospitalization or the intensive outpatient is if you are, maybe the situation isn't so severe that you're in danger of harming yourself or someone else, but they still feel like once a week talk therapy is just not quite sufficient to address the needs, then they might recommend a partial day program where you attend throughout the day. It's usually about 6 hours, and they oftentimes will include lunch. And most of the therapies there are going to be group therapies. Throughout the week, you do have opportunities to visit with the therapist individually and work with a psychiatrist that's on staff who will meet with you periodically. And then you will continue in the partial program. Usually it starts out 5 days a week. It could start out less. Sometimes it's 3 days a week, or you may start 5 days a week and drop down to 3 days a week or less as you continue throughout the program. And those typically go for about 6 to 8 weeks. The intensive outpatient program is the next step down to where it's not a full day program, but instead it's a half day, usually about 3 to 4 hours. Essentially, it's the same in terms of the program offering group therapies and sometimes seeing an individual therapist in the program to talk about goals and see how you're progressing. The psychiatrist doesn't meet quite as often, just checks in to make sure that there's not any changes needed in medications if someone is prescribed medications. So those are in lieu of having to go into an inpatient hospital setting, which we'll talk about here in a moment. So they'll be able to monitor, make sure that the acute symptoms that you're having are being addressed so that they don't escalate to the point where you may need a hospital program. They are hoping to continue to see that improvement so that you're going, to a less intensive program. But sometimes, if that's not the case, then they might make a recommendation that you actually go into a hospital program. Or sometimes it happens the other way around. If you're in a hospital program and you're getting ready to leave from that situation, then going into a partial program or an IOP program can be a step down, where you're still getting a little more closely monitored, especially if there's new medications or if you're going through some situations that need closer monitoring of a physician and so forth. So those are good options for folks. Now, of course, the inpatient hospitalization is when you're having severe symptoms. This may include folks who are having hallucinations and delusions, some sort of paranoia. Certainly, if there's any suicidal or homicidal thoughts and ideation, those would be serious situations where the person's safety is an issue. When someone has not slept or eaten for many, many days, that's characteristic of some mental health disorders, bipolar being one of them. And that could be something that needs to be addressed in a hospital setting and oftentimes medically monitored. And certainly if there's withdrawal symptoms, chemical dependency, addiction, where people are withdrawing, they would want to have medical assistance while they're going through the early stages of that. So hospital programs can assist with those situations. And they're generally short term. It's really to stabilize and get the folks through the initial um, part of that condition so that they're no longer at risk of harming themselves. They may need to make adjustments or start a medication and then make sure that there's not too many side effects. The other, you have a regular care from nursing staff and from physicians. They have psychiatrists on staff that will see you several days a week during your stay. And so these are really for kind of emergency care situations. They may even take care of a few health needs, particularly with withdrawal and those kind of things, or if people have not been eating well, and help with just nutrition and getting your body back on track. And inpatient can happen in several different ways. It could be a part of a wing of a medical hospital, traditional medical hospital. There are some of those, but most often it's a psychiatric hospital or mental health center that will provide that. And of course, we typically have state hospitals in many areas. Some of the ones here in Austin would be such as Austin Oaks, Austin Lakes, Georgetown Behavioral Health, Rock Springs, Cross Creek Hospital, just to name a few here in our area. There's more. So let's move on to finding that fit. One of the things when you're looking at programs is most of them are going to ask about insurance. That's one of those sort of necessary, unfortunate things that is frustrating for folks, is that insurance seems to dictate a little bit about what choices we feel like we can make as a consumer. But the reality is many of these types of services can be costly. So checking to see about insurance is an important thing. And of course, they'll do that for you when you call. Oftentimes they'll ask you, in their admission department will ask if you're a receptionist, if you have insurance, and they'll take that information and they'll provide that to you so that you know what's covered and what's not. Of course, if it's not covered, then that's where you may need to go to some other resources, and we'll talk a little bit about that. Sometimes people are stopping to say, well, what would I feel more comfortable speaking with a female therapist? Would I feel more a psychiatrist? Would I feel more comfortable speaking with a male? Does it matter? But that's something to think about when you're making inquiries to try to determine who would be the best person to go to see in a therapeutic setting. So before we go into that, sometimes, let me go back to the individuals. This is where you would also want to double check and make sure that the person has the training in whatever issue you're concerned about. Therapists, psychotherapists in the area have specialties oftentimes. They may work with patients who are PTSD, or they may work with clients who have specific disorders that they can address with some of their training, their specialized training that they've received. So checking with their training and asking about their training is a critical question, and making sure that they are licensed. That's a critical question to make sure that you ask when you're checking into whatever provider you're talking to. And they should feel free to give you that information. Of course, location. That is unfortunately sometimes one of the first considerations for a lot of folks if they have limited transportation issues. There's maybe a great facility, but it's 50 miles away. So the likelihood of being able to actually make your way to those facilities or appointments is sometimes more challenging. So looking at what's in your area and trying to get information about who may be appropriate for you to see, but is not going to be a situation where the location is going to be a challenge to get to those appointments. So And we're lucky here in the Austin area. We do have many, many very good providers. And this is a reminder that sometimes the first person that you contact isn't always going to be the best fit. And, don't stop looking. These kind of things sometimes take time, and giving yourself a chance to maybe try a couple of different people if the first one doesn't seem quite right. I would say that give them a couple of chances, maybe one or, unless you just really didn't hit it off the first appointment, but give yourself a couple of appointments and really get a sense of, is your discomfort coming from, the fact that maybe you're dealing with some issues that are very difficult, or is it really that it's just not a good connection there? So in order for it to be a benefit, it is something that you want to feel comfortable going, a person you want to feel comfortable going to. And try to, again, separate that. Is the comfort or discomfort the person, or is it, that these are difficult issues? And now where to go? Of course, the first thing is, if you're having a mental health crisis where there's a safety issue, where someone might be at risk of harming themselves or at risk of harming another individual, this is an immediate need, urgent situation. So, of course, the first thing you would want to do is to get help right away for that person. You would want to immediately call 911 if need be, if the person needs an escort and you're not able to do that, if they need to get to a hospital right away. Sometimes you have to go to the emergency room before you can get into an admissions department at a mental health hospital. So, ERs and 911 is certainly an option. When you call 911, make sure they know it's a mental health crisis. So if they, the people that they send out specialize in that area. And then there's a hotline, a suicide hotline, that the 1-800-273-TALK. And I actually took the time to call that number. I wanted to make sure that this is a number where someone was going to get an immediate response. You've heard people talk about sometimes they, call for help and were put on hold, or which we wanted to make sure that this is not the number where that's going to happen. And in fact, the person answered within, I think, about 3 seconds. I timed it. It was very, very quick and seemed very knowledgeable and very responsive. So that's a real good resource, particularly if it's a situation where somebody might be at risk of harming themselves or others. If that's the case, if it's someone in your family or someone that you're with, never leave that person alone. Make sure that wherever they are, that you're going with them. And, even if it's to the restroom, standing outside the door with the door cracked, just so you know that they're not trying to do something to harm themselves. So that's going to be important. And if they've shared with you, or if you've asked, at that point, what they're thinking of doing. Of course, if they have a plan, that generally indicates a more serious situation, but making sure that they don't have access to things that they could harm themselves with, and just removing those things from your home or from wherever you are. So those are some steps that you can take if it's a crisis situation. Luckily in Round Rock, and we'll talk a little bit about Round Rock in a little while, we have some good options for you right now, especially with the development of our new safety and security department in collaboration with the behavioral health services. So we'll talk in a moment about that. But if you, the other service that's available in our community is the Williamson County Mobile Outreach Team, where they'll come to your home and do assessments. There is a cost for that, but they are sometimes covered by insurance. But the main thing is to get help right away. And they are trained in mental health emergencies. So in those situations where maybe you can't get the person to go with you to an ER or to a hospital setting, is a mobile outreach team. And 911 can connect you with that. that's why it's important to let them know it is a mental health emergency. This is one Dr. Grosso put in, and I have to agree with her because it says don't just Google counselors in Round Rock, Texas. You'll be frustrated and overwhelmed. As I mentioned, we have a lot of good providers here in the area, so you'll get just a slew of names and different credentials and different initials that I'm not even familiar with all of them, and I'm in the field. So it can be very frustrating to not know who to call. So if you are thinking about, and of course, this is where we turn to the prevention part of this, where before it gets to a crisis, hopefully folks can take steps to get the support that they need. So rather than Googling, counselors in Round Rock, here are some other options that may get you what you need with less frustration. So oftentimes referrals come from friends. If you're close enough to someone and share that you're interested, then you may have a friend that you know of that's seen someone and find out about that. Our friends who work in this area of mental health and can give you some information. But not everyone's completely comfortable sharing mental health information with friends. Maybe it's not a friend that they're feel as comfortable with. So the other thing is to call your primary care provider. They should have listings of mental health providers in the area. Many employment agencies have employee assistance programs. So that can be a very good resource for you. If you know that your company has what they call an EAP, Employee Assistance Program, they oftentimes will offer a number of sessions at no additional cost. It's just part of your program and part of one of your benefits. So that is a good option for a lot of folks if that's offered. And if you have insurance, hopefully that's the case for most folks, they can call the insurance company directly and get a list of providers. And that removes that question of whether or not insurance covers that particular person. So that makes it a little bit quicker to get to a provider right away and know that the cost is covered or that at least part of it will be through your insurance. And this is a great resource for folks in the community. I'm going to show you, I don't know if you're familiar with Psychology Today. It's actually a publication. Of course, they have an online site. But with Psychology Today, if we can get that and see if that's going to let us connect to the link. Did it give us our link? Here we go. Maybe it's going to give us our link. Here it is. I'll open it through Chrome. No, don't open it. Okay. Well, let me just tell you what happens if you click on this. I worked on this earlier, but it's not wanting to let me go to the site. Psychology Today has what it's called Find a Therapist. So if you clicked on this and it went to their site, there's you can then click on Find a Therapist and put in your zip code or city, and it will list the people in the area and their credentials and a little bit about their specialties. So this is a great way to get a little more information rather than just going from a call list that maybe your insurance company gave you or someone else might have given you. It gives you a bit more information. It has a photograph of the individual, not that that matters, but sometimes you can just again, see a little bit more about that individual. So this will certainly be something you might want to check into if you're looking for a therapist in the area. Now, what to expect when you actually go in for mental health care for an individual psychotherapy session? They call it talk therapy because that's what you're doing for the bulk of the time. But while you're talking, the therapist is doing a lot of assessment. And the first session, of course, they're going to want to know what's bringing you in. That's oftentimes the first question they'll ask, what's bringing you in today, where you'll share your concern or the feelings you're having or emotions, or if it's your child, or family member, talking about the issues going on there. And then, of course, they're going to want to gather some relevant family history to see if there's any history of depression or chemical dependency or any other medical things that could be part of what's going on. So that's an important part of the assessment. And of course, they're going to want to talk to you about what your goals are for your time with them. What are you hoping to accomplish? What would you like to see change? Um, some of that's just, I want to feel better, but even going beyond that, I want to be able to get back to my normal activities. I want to be able to sleep better. I want to be able to, feel the enjoyment of going out with my family or going out with my friends. So whatever it is that, I want to feel less anxious when I, go to work each day, or just, whatever the issue is, sharing what your specific goals and what you would like to see come out of those sessions together. And then they should discuss what options you have that may help you to reach those goals. Do they have some additional training they could offer? Do they have some additional lab work or testing they may want to offer? Sometimes certain mental health conditions may be related to some other deficiencies physically. So they may want to go that direction. So just helping you look at those different options and give you an idea of, how they run their sessions and how often they meet with people, and just give you a little bit more information to make your decision about whether this is the right person for you. And of course, they should include some information about cost, particularly if they're offering additional, testing or lab work or any of those things. They should be able to discuss with you what the cost, not only the cost of their sessions, but any additional services that they may be providing. So that should also be part of the first session. So that's a little bit about what to expect there. And again, as I said, if you're feeling comfortable or if you're not sure, go back to second session, see how it's going. And then if it doesn't seem to be a good fit, you may have to go elsewhere. That's going to be important to feel comfortable with whoever you're working with. Okay. So we're going to switch over a little bit to what you can find in Round Rock in terms of getting some support. And especially if it has to do with a student, a child, or someone that you're concerned about that may be attending one of the schools. Our campus counselors are the first person and probably the best one to contact initially if you have a mental health concern about someone in your family, or even if it's something you'd like to get some resources for yourself. That's certainly something they can assist with. Typically the role of the counselor is to not only promote the academic success of a child, but they also want to support the mental health needs of every student. And again, that oftentimes extends to family as well. They do work with the teachers and administrators, and oftentimes the nurses. Nurses sometimes are a good person to know if there's a physical need that's related to what's going on, that the frequent tummy aches that it's causing the child to go to the session is maybe really, or go to the nurse is really maybe more about anxiety. So they work closely with other staff members at the schools. Now that's also not to say that they share personal information, because they do honor confidentiality and make sure that whatever they share, they've talked with you about and made sure that this is something that you're comfortable sharing or would like them to collaborate on. And one of their roles is to assist with referrals for services to students and family, not only outside resources, but also resources that are available to Round Rock ISD students that counselors can make referrals to. We have some programs now that are available to the counselors to offer families. We have some partnerships with Bluebonnet Trails, mental health centers, and we also have some partnerships with Dell medical school to offer some additional support for students. And they're primarily working with elementary age students. Well, they work with all students. Bluebonnet Trails, actually all ages. The ones that work primarily with elementary is another, the Dell agency that's partnership that we're just recently were able to work to get in our district. So we're very excited about that. And we also have some services that are specifically to help middle school and high school. So we really are trying to address the needs of all students in our district, which is why the behavioral health services team has been able to expand and now is starting to bring on board some social workers in each learning community, eventually hoping to have at least 2 in each learning community so that they can work with families beyond what's happening at school and also take care of some of those additional needs. So there's some, but counselors are the ones to go to ask about that because they can help direct you and make those referrals to see if that's part of what may be helpful. And of course, they're also very familiar with the community resources. So while counselors will not specifically state an individual for you to go to, that's not something they would want to do because it's your choice, but they could provide you with names of different services that might meet your needs. So that might be very helpful. Before we go back, the other thing too that campus counselors can do is if there's a behavioral need where they're needing some additional time with the counselor, they do work with students. They have, many of them call them a lunch bunch session where they'll have them come eat lunch and do some skill building sessions with them at school. They often will do some groups with students working on some specific behavior skills. And of course, that's a lot of what their guidance lessons are geared toward, is helping to build those skills and the social emotional learning piece of that. So campus counselors are good contact people. Now I'm going to take a moment to help direct you on how to find resources in Round Rock ISD. And here I listed navigating the maze. How can you find what you need? Oftentimes when I would go to the site to help parents find a resource, I found myself even, going, clicking from one page to another and one resource to another. And there have been attempts to get the information in one area. So we're making a lot of progress to have those resources a little bit easier to locate. But I just wanted to make sure that folks know how to do that, because I think it's still, if you haven't taken some time to just explore, you might still find that it feels a little bit like a maze. So I'm hoping that this link will work. If not, I'll walk you through it just in discussion, but if there's may not. I think I'm in a situation now where I'm not able to link these things. It's going to go to that same page. Yeah. All right. So let me just walk you through that. If you go into the Round Rock ISD website, just type that in and go to that homepage. Across the homepage, there's a banner right now, and in the middle of that banner is the the Imagining Education, Reimagining Education, and that's a spot where they list a lot of useful information. Certainly, a lot of it has to do with the current COVID pandemic and virtual learning, and just a slew of information. And I think it's become quite overwhelming for many of us, not just parents, but also for staff to help families to locate what they need. So one of the things that's very useful in that reimagining education is to click on that, and it will take you to a page with a number of different useful, lots of useful information actually. But if you are looking specifically for mental health needs, if you scroll about halfway down that page, there will be the counseling resources listed and the behavioral health services resources listed. And both of those are very good sites to go into, pages to go into. The counseling resource, if you click on that, it will take you to a page where it has some videos of counselors in our district and a counselor, Jenna Fleming, who was in our district as a campus counselor, but she's now has a private practice up in Georgetown. So just talking about a little bit about how to access community resources for counseling. And she and the other counselors talk a little bit about that. But there's, in addition to that, there's a heading that says parent and student resources. And you can click on that and it'll take you to a page that has many things, stress and anxiety. It has information on how to work with students on some academic issues, some behavioral issues, transition to issues. So it's got many, many helpful resources. And if you're looking for some outside communities, it's got that as well. Some of the communities, mental health centers that we have in our community, it's listed on that page also. The page where you clicked on counseling services, there was the behavioral health services tab as well. You can go back to that and click on behavioral health services. And it too has parent resources in a little different way. Dr. Grosso did several videos on helping parents with how to talk to your kids about what's going on right now, how to talk about difficult topics, some resources on self-care for parents, much needed topic right now with all that parents are having to juggle. And so a number of different very, very useful videos there. There's also just some tips, a sheet on tips of how to talk with kids through the COVID situation, and that same community resource guide. So you'll see that also listed on that page. So I wish I could have shown you that today, but my links that worked earlier don't appear to be wanting to cooperate with us this afternoon. But just those would be two really good locations to go to. So again, when you go into the Round Rock ISD site, click on Reimagining Education and then scroll halfway down. And that's where you'll see those headings for counseling resources and behavioral health resources. And those will take you to the locations I mentioned that have many listings. So that gets us to where we're about to wrap up for this evening. This is a quote that Dr. Grosso put on here that I think is so true. It says, "I will persist until I succeed. Always will I take another step. If that is of no avail, I will take another and yet another. In truth, one step at a time is not too difficult. I know that small attempts repeated will complete any undertaking. Excuse me." And author Og Mandino, who is actually an American author from Framingham, Massachusetts. So he's wrote many books, and I think this certainly applies, that if you're on these sites and it doesn't seem to be taking you where you need to go, please keep trying. There's a lot of resources out there right now, and hopefully with a little bit of time and exploration, you'll be able to find what you need. And if not, please do contact your campus counselor at the school where your children may attend, or anyone in the behavioral health department that I work in can help you with those. So you can certainly contact someone at the central office to get that information as well. Dr. Grosso or myself can give you that information if needed. So let me just stop at this point. I've done a lot of information. If there's any questions right now or any comments that we need to address, I don't know that we see anything in the chat at the moment. So I hope you've been able to get some information that'll be useful to you. And if you missed any part, again, this is recorded and will be posted where you could go through it again if need be. So thank you for joining us this evening, and I appreciate you being here. Good night.